Ladies and gentlemen, we're about to get started. If everyone can make their way toward the podium, please. All right, ladies and gentlemen, and at this time, please join me in welcoming the Governor of the great state of West Virginia, Governor Earl Ray Tomblin.
Well, good afternoon, everyone. It's great to be here today, surrounded by so many people who are fighting substance abuse all across West Virginia and helping those struggling with addiction to get back on their feet and onto the path toward recovery. I'd first like to take a moment to recognize Commissioner Vicki Jones, right here in front with a big smile on her face, on the Bureau for Behavioral Health and Health Facilities, and officials from the West Virginia Department of Health and Human Resources who are also with us today, as well as First Choice Health System CEO Steve Burton and his team. And it's because of all of your all's hard work that we're here today to celebrate the one-year anniversary of West Virginia's first ever 24-hour helpline for those struggling with substance abuse. Now, we all know that across West Virginia, substance abuse is a heartbreaking problem individuals and families face every day. Over the years, it has grown into a statewide epidemic, one that is affecting our homes, our schools, and our communities, but it will be stopped. As you know, fighting back against substance abuse has been one of my top priorities, and I'm confident, thanks to our joint efforts, we are providing those struggling with addiction the opportunity to seek help, to overcome addiction, and return to their families, their communities, and their workplaces. And we need to do even more, so we're working hard to expand and improve community-based treatment options and recovery services through a number of partnerships representing people and agencies from local, state, and federal levels. Over the past several years, I'm proud of the work that we have all done together and the progress that we have made. As we mark the one-year anniversary of this invaluable resource, we're also here to celebrate our successes. In the past year, the call line has received over 5,200 calls. Of those, 2,250 were individuals asking and seeking help. And I'm proud to report that each of the 2,250 West Virginians who sought help were connected to at least one resource to begin or continue their fight against addiction. Today's substance abuse prevention services are provided in all 55 of our counties. Throughout the state, we have 132 crisis detox beds in residential treatment facilities, with more sites under development. We have a total of 118 beds designated. We have 118 beds designated for short-term, postpartum, youth, and long-term residential treatment, and nearly 700 beds are available to those seeking help and support at peer and provider recovery homes and facilities. Just this week, the U.S. Department of Health and Human Resources announced the U.S. Department of Health and Human Services, I'll get it right here in a minute, guys, announced $53 million in funding to 44 states to improve access to treatment for opioid use disorders, to reduce related deaths, and strengthen drug misuse prevention efforts. Additionally, our office was awarded an opportunity through the National Governors Association to attend a learning lab to develop state strategies for reducing opioid overdose deaths related to heroin and illicit fentanyl. Our team will attend workshops focusing on innovative policies and programs, best practices to increase access to substance abuse treatment, and to improve timeliness of overdose reporting to track and respond to overdoses. We're working closely with our prisons and correctional facilities to ensure all West Virginians are provided equal access to substance abuse rehabilitation. The Division of Corrections operates 9 residential substance abuse treatment units in our correctional centers across the state. These units provide 6-month to 1-year courses of inpatient treatment and can together treat a total of 491 individuals. We've expanded this model to our regional jail facilities. Southwestern Regional Jail hosts 2 units, one for males and one for females. Each are currently treating 28 inmates in their inaugural programs. Under a pilot program overseen by the Department of Health and Human Resources, medication-assisted treatment is available for paroling or discharging inmates who have completed substance abuse programs and who show a motivation for continuing treatment. As of June 1st of this year, 29 inmates received this treatment before leaving their facilities. The pilot program has been expanded through legislation passed this year to begin development in all of our regional jails. Both prisons and jails offer outpatient substance abuse counseling programs, including 12-step peer-to-peer programs. We have adopted a curriculum that includes a 39-session program focusing on addiction education, transition skills for recovery, and relapse prevention. We have developed a substance abuse treatment program specifically for women based on the guidelines established by the Federal Center of Substance Abuse Treatment and offer a 7-week educational program focusing on substance abuse and its effect on our families. In the coming weeks, we're about to kick off the 20th round of the Regional Task Force meetings for the Governor's Advisory Council on Substance Abuse, and members of this task force have worked incredibly hard to combat our state's drug problem. Since establishing the working group in October of 2011, West Virginians representing law enforcement officers and the judicial branch, faith-based organizations and health providers, local officials, concerned family members, and many more have shared valuable input. These recommendations have led to a number of critical reforms, including expanding access to Narcan to first responders and family members of those struggling with addiction, providing funding to expand critical substance abuse treatment services in communities all across West Virginia, and the triumph we're celebrating today, the 844 Help4WVU call line. The Help4WV, our 24-hour call line, provides referral support for those seeking help and recovery services. First Choice Health Systems, a West Virginia-based company, has also successfully operated our state's problem gambler helpline for more than 15 years now. Their employees are professionally certified and trained to engage callers in a conversation, working on a one-to-one basis to determine the best steps moving forward for each individual. As many of us know, for those struggling with addiction, the first step is often the most difficult. But today, we're offering West Virginians across the state an important opportunity to just talk. Discuss available treatment options, choose a path, and begin the road to recovery. No caller is ever placed on hold, and people are immediately connected with treatment staff representing the best and most appropriate treatment option. 844 Help4WV also provides appointment reminders, directions, and transportation assistance to ensure that all callers remember their appointment and show up on time. Follow-up phone calls are also placed after the first appointment, the first month, and after the first 3 months to ensure that patients stay on track and offer other available resources. It was our hope to make this call center a place where anyone could call anytime to receive clinical information or resources on community-based programs and support groups in their local area. The 844 Help4WV call line includes more than just substance abuse recovery assistance. This call center will also provide help to those battling other behavioral and mental health struggles, such as suicide and depression. But it's because of the work done by so many of you here today that we can celebrate all that we have accomplished. We still have a long road ahead. But as I said before, we will win this fight against substance abuse and move forward toward a happy, healthier day for all West Virginians. And I also want to recognize my good friend Steve Williams, the mayor of Huntington, who his area has had lots of problems in recent months and years. And I'm pleased to have Steve here today to be part of this celebration. Also, Dave Hardy, member of Kanawha County Commission, who's also very interested in ridding our state and our counties of substance abuse. But at this time, I'd like to welcome First Choice Systems CEO Steve Burton to the program. Steve, you and your team are doing a great job.
Good afternoon, everyone. I am amazed that it has been 1 year since we all gathered to celebrate the launch of Help4WV. Governor Tomblin, 1 year ago I applauded your efforts to make this call line a reality. Today, I want to let you know that thanks to your leadership and the help of your administration, thanks to Secretary Karen Bowling, Commissioner Vicki Jones, and Deputy Commissioner Kim Walsh, today, over 5,200 West Virginians have now reached out for help for themselves or a loved one. 5,200, a number which is larger than the populations of most of West Virginia's towns and communities. This call line has become a vessel of hope and help for individuals struggling with substance abuse and behavioral health issues. I'd like to take this opportunity to thank everyone who has supported our efforts and promoted our cause. Thank you to the First Choice Board of Directors for understanding the importance of this call line and for allowing me the necessary time to make this call line a success. Thank you to the providers. Our providers could have ignored us. They could have told us they receive enough referrals as is. Instead, they welcomed us with open arms, taking our calls outside of our office hours, helping us work through client barriers to treatment, and ensuring our callers receive the vital treatment necessary to deal with their disease. I'd also like to point out one individual whose passion for helping has been evident from the beginning, and she will kill me for bringing this up. Kimberly Walsh, I want to thank you for all you have done. Problem solving, program development, staff development. I once woke up at 6 a.m. to a text conversation between Kim and Program Director Heather McDaniel. They were resolving a difficult referral issue, and 6 o'clock in the morning, I get it. I found out later that Prestera CEO Karen Yost had also been involved in late night texting. The father in me wanted to tell them to put their cell phones away, but the CEO in me knew that would be pointless. I can also recall during our third meeting, Ms. Walsh taking a call on her cell. After 5 minutes of case management, Kim ended what was obviously an emotional phone call. After our conversation ended, I asked what had happened. Ms. Walsh responded, that was the father of a 4-year-old little girl whose mom had recently overdosed. We are trying to find the 4-year-old help to deal with her loss. I knew then, and my team knew then, that this program had to be more than simply a hotline. It had to be a place where residents of our state could find hope. Ms. Walsh, your passion is unmatched. We are very lucky to work with you and all the folks at BHHF. Commissioner Jones, you have an excellent team. We appreciate your leadership and your guidance. I would be extremely short-sighted and probably punished if I failed to thank the awesome, amazing staff of the call center that's right behind me. I challenge them daily to treat the individuals on the other end of the phone as their loved one. Treat them as their brother or sister, their mother, their father. Every day they have met my challenge. They are on the front lines of this battle, and slowly but surely they are winning the war. Our call agents are vital to the success of Help4WV. They are the first voice the callers hear, and they have responded with compassion and empathy that should be applauded. Please join me in a round of applause for these hope makers. While our call agents have been important in answering the line, Our providers have also answered the call. Thanks to detoxification programs at Highland, Seneca, Westbrook, United Summit Center, Valley, Northwood, FMRS, and the list goes on and on. Folks needing detox services are oftentimes receiving help within 24 hours of making that call. Detox is only one area in which help has been available. Our call agents are lucky to have a resource directory of over 1,000 resources in our state. So to those who say we don't have help available, yes, we do. Just make the call, and we'll take it from there. On top of providing treatment, these same folks voluntarily disseminate information on the helpline and help ensure everyone in our state is aware of the helpline and the services it provides. Lastly, Governor Tomblin, I would like to thank you. Thank you for your vision, your trust, and your action. You observed the epidemic, heard the cries for help, and responded with action. While many leaders try to sweep addiction and behavioral health issues under the rug, you have faced it head on. While the fight is not over, the tools you have given us will help us fight this disease well into the future. Thank you. I want to say, I believe this is the third time you have visited First Choice in the past year. So you know, in case you're looking for a gig beyond January, we could always use you to answer the helpline. As we head into year 2, let's all make a promise. Let's promise not to allow our passion for fighting addiction to go by the wayside. Let's promise to educate our community so that stories of addiction and overdose are met with empathy and not ignorance. Lastly, let's make sure that every West Virginian knows that treatment is available in the Mountain State and that recovery is possible. I thank each and every one of you for attending today, and I ask each and every one of you to make yourself at home here at First Choice. What I want to do next is introduce our next speaker. And so you all know, one of the most difficult things you can do is tell your story. Whenever you enter recovery, you enter treatment, sometimes that can be extremely difficult to even explain to yourself and to learn what your path was and how you got there. Our next speaker is a former caller of ours who is now a person of recovery. So would you guys please give a hand for Mr. A.J. Walker.
How's everybody doing? My name is A.J. Walker, and I'm a recovering alcoholic and addict. I get to the podium, this happens all the time. All right, we're good. You know, they wanted me to tell my story, and the great things are happening, so I don't want to talk about the negative. You know, I want to talk about the positive. Every time. So anyway, I started using at a really young age, 9, 10 years old. And I went through life being told I'd never amount to anything. And anyway, I'm not going to go into much of it. Obviously, I ran amok in my life, spent a lot of time using and abusing, just ruining lives, running through them like a tornado. Thank you. I don't know why this happens. Anyway, so I got to a point, though, where I was just beat down physically and mentally. Like, I remember going to work one day, and my choices were 3 things. The first choice was I was going to run off somewhere and completely change my life and start over. But that doesn't work with us. Wherever we go, that's where we're at. There we are. You know, we run amok no matter where we go. Anyway, so that was my first choice, and I realized, you know, I'm broke. I can't do that. I'm going to make it maybe 100-some miles down the road. I'm going to run out of gas, call AAA, get my gas can filled up, and keep going. I'm still not going to get anything because I just left my job and stuff like that, so I had no money. You know, that's not a choice anymore. My second choice was to kill myself. A bullet looked good at that point. But I had a third choice, and that was to get help. And they talk about this moment of clarity, and that's exactly what I had. So I hit that moment of clarity, and I finally told some people what was up, and that one being my dad. And it was a tough time to tell him what was up. But anyway, he said, let's get you up to Parkersburg. I have a brother that lives there, and he used to work for the Bureau and was the lead researcher for drug and alcohol abuse in West Virginia. And I thought, he's going to know how to fix me. There's the answer to my problem. But I went up there and it wasn't that. He, you know, he had his own thing going on. I couldn't ask him to just drop everything. That's what I've been doing with people forever. So he handed me this number because he had to go out of town. He's like, you need to call this number while I'm gone. And it just so happened to be that number right there. And when I called that number, sorry, y'all. I called that number, I was cared for as a person. Sorry. I got hope out of that phone call. They talked to me as a person, not a drug addict. And, this is crazy. But they got me into a crisis stabilization unit, got me detoxed. I got a detox 7 days later, and the phone rings, and it was them. They called me back to see how I was doing. And when I was on the phone the first time, they talked about a place called Amity, and it's a 28-day treatment facility center, and it's a really great place, and they helped me get in there as well. So I got into there, 28 days, and I got out. Phone rings again. It's 1844 Help for West Virginia. They wanted to know how I was doing, make sure that I was getting along all right. But and I did, It's really helpful to know that somebody actually cares. A person I've never met before actually cared about me. But so I get out of treatment, and we're talking about all the good stuff going on. I want to talk about some of the things that have happened to me in recovery. First of all, my sobriety date is October 27, 2015. So within roughly 10 and a half short months of sobriety, I've done a lot of great things that I never thought were possible. I'm employed. I go to school. I'm in school right now. In roughly 6 years, I'll have a master's degree and be a counselor for drug and alcohol abuse. I'm employed by somebody that, actually gave me a chance. But, I get to help people every day. And one of the greatest things that's happened to me yesterday, actually. I just got hired at the treatment facility I went to. But, it's crazy to think that over a year ago I was just beat down and I wanted to kill myself, but I made that one phone call and I got the help I needed. So, just like they said, people say that there's nothing out there. There's a lot of treatment out there, and it's really helpful. But, it's crazy to think because I was one of those people. I was helpless and I was hopeless. But I called that number and they got me tied into resources. And today I'm able to be of help to other people. I'm hopeful, There's actually stuff going on and it's amazing out here. But it's really all I got. Sorry about tearing up the whole time. Thank y'all.
We talk about everyone always wants to see the face of addiction, and a lot of times when we hear overdoses and those types of things, we don't understand there's a person to that. That's just not a number, that's an individual. Our next speaker is here to talk about some services that are going on with regards to substance abuse. So if you guys can please welcome Haley Walker, Case Manager for Ray of Hope.
Thank you, Steve. Thank you, AJ. That was wonderful. Thank you, Governor, for being here. Thank you all for being here. Whew, this is a little different from behind the podium. My name's Haley Walker. I'm the case manager at Ray of Hope here in Charleston. I'm a certified alcohol and drug counselor. I'm a member of the Governor's Substance Abuse Task Force in Region 5. And I'm on the board of the West Virginia Certification Board of Addiction Prevention Professionals. I didn't mess it up. I also have a little over 7.5 years of personal recovery. And thank you. The helpline is a wonderful thing. I remember going to the regional meeting last year and hearing about the launch of the helpline. Steve did his little thing, and it sounded great, and we hoped it would be great, and we got a bunch of little cards and things, and took them back to Ray of Hope. And so what I'll tell you about Ray of Hope is we're a sober living home for women. We're here on the East End. It's a 6-month treatment, or not treatment program, 6-month sober living home, and we do require 30 days of continuous sobriety in order for our women to be eligible for Ray of Hope. Once they get to us, we're abstinence-based, we're 12-step oriented, and we're personal responsibility driven. So there's a lot of things that they have to do when they get there, and they have to have a little bit of education behind them. So unfortunately, a lot of times women would call and they wouldn't be eligible for Ray of Hope because they haven't successfully completed a program. Maybe they're still in active addiction. They might be in crisis. And so what we struggled with were calls every day of women who were in a position where they wanted help, but we couldn't necessarily help them. And so we had a list about 30 agencies long of places that we could forward these women onto. And after about 10 numbers, that you could tell we started losing their focus, but we did our best to give them what they needed. And so at the launch of the helpline, I was really excited to have one phone number to tell these women that were calling, that where they could receive help 24 hours a day, 7 days a week. And so we started using the number, and it's been wonderful. One of the biggest things that I've noticed when we refer women to the 844 Help4WV, they don't call back unless they're calling for our services because they get what they need. A lot of times we would have repeat callers. Well, I called that number. Can you give me another number? I called, not with the 844 Help4WV. It's been a wonderful resource for us. We've really enjoyed being able to forward women on and sing the praises of the helpline. I've had women come to Ray of Hope who utilized the services at the helpline. They got into detox within 24 hours. While they were in detox, they got in that 28-day program. When they left the 28-day program, they came to us, and that's so important, the continuity of services, because there's a moment of clarity in this little amount of time that we have to help these women and these people in active addiction. And so, again, I want to thank you also to the law enforcement. I know they don't always see the faces of recovery like AJ and myself, so thank you all for putting your lives on the line. And I think that's all I have now. Now I'm tearing up.
Thank you, Haley. We have one more speaker who's been very important to the rollout of Help4WV and has been involved from the beginning. So if everyone could please give a hand for Vicki Jones, Commissioner for Bureau for Behavioral Health and Health Facilities.
Thank you so much, Steve. Wow, I'm honored to be here today. I can't say enough good things about Steve and the helpline and the collaborative spirit that we've held from day one, really even before then. And for the board members for First Choice, I want to thank you and the efforts that you've allowed to be created with this helpline, so thank you very much. I think that, these are hard acts to follow as I come up here because I'm so proud to be a part of be a very small part of being able to help individuals on a daily basis. It means the world to us, and it makes a difference in West Virginia. When I go to other states, when I'm in other conferences or I'm on a conference call and other states are involved, I get to hear how wonderful they think West Virginia is. They think that we are wonderful in our innovative ways and our efforts to combat substance abuse here in West Virginia, one of the most challenging states in the entire country. And we're getting recognition and praise as being innovative and moving our state forward and finding solutions. It is true. It's hard to hear that we're still struggling with being number 1 or number 50 in many areas, but it's so very true. Oftentimes our citizens, our providers, and many of us in this room don't get to hear about the successes we're making as a state or that we are making a difference. I think you've heard that today. You should be aware that West Virginia has come to be known as a leader in the country in developing and improving the substance abuse and behavioral health system of care, and we are doing so in a collaborative manner. I think that's really evident by the number and different types of individuals that are here today. I talked about being innovative and how we are known for being innovative. The helpline is a prime example of how we are doing so and how we are being able to make a difference and how the country is taking a look at what West Virginia is doing and wanting to duplicate our efforts. In fact, we were just asked to speak at a national conference about the helpline. So the helpline is not only important to West Virginians, but Governor Tomblin, we're making a difference across the country. And so I want you to know how very appreciative we are. As I sat here today, kind of listening to work that's going on in West Virginia, all the initiatives that are being developed, not just from the state's level, but also from the community and the grassroots efforts that are going on. And that's evident from the regional substance abuse regional task forces that have been developed and have held or are getting ready to hold 120 meetings in the past 5 years. Pretty incredible. And we got to hear about the federal funding that we're receiving, so we're maximizing our federal dollars, not just utilizing taxpayer state general revenue funding. We've developed partnerships that previously were not developed. We've had providers come to the table, as Steve talked about, and really step up, not only in working with First Choice and each individual out there, but with the department and other agencies within state government to make a difference as well. And the priorities that the Cabinet Secretary for the West Virginia Department of Health and Human Resources, Karen Bowling, is making, the legislators who have really stepped up to work and help develop and change laws that have come across in West Virginia to make a difference. And I'm amazed at all of those efforts. And Governor Tomblin, that's because of your leadership. We've gone as a state from working in silos to working as partners. And we've gone from being hopeless to being hopeful. It's clearly evident today. We've heard about successes we're experiencing to help individuals navigate our system. And when we began this journey many years ago, one of the things we kept hearing over and over again was, we don't know where to go for help. We don't know if there is help. We hear there's not anything out there, but how do we know if there really is? And this helpline is what made a difference in navigating that system. Individuals, whether they are themselves, a family member, or calling for a loved one, they're able to receive resources and actual services themselves. Governor Tomblin, I have said this, and I want to say it again. You are to thank for all of this. You are making and have made a difference in how we in West Virginia have really behaved and embraced solutions for substance abuse and moving the needle in terms of improving our system of care. You put this 24-hour helpline in place. You supported the development and the expansion of the substance abuse infrastructure. It's very difficult to have a helpline if you don't have an infrastructure in order to have someone receive those services. And you've made a difference in that, so thank you very much. I'm going to be a little bit duplicative or maybe repetitive here because I think Steve actually got a hold of my speech before I came here. But I want to also thank Kim Walsh. She's the Deputy Commissioner for the Bureau for Behavioral Health and Health Facilities, and she is the person that, despite the struggles and the challenges we face every day, and negativity at times, she continues to prioritize the efforts that Governor Tomblin has created as his vision. She's responsible for seeing through the call line, through its implementation, and many other initiatives that if I tried to share everything with you, we would have to have had Steve serve dinner as well. So I'm not going to take that time, but I do want to personally thank you, Kim, for being so important to me and to everyone out there in West Virginia. I also, too, want to thank the operators that are really the ones behind the scenes you don't get to see that right now are talking to individuals. I can hear them. They are making a difference. Just as important are you, the individuals that have not only taken the time to be here today, but take the time every single day to prioritize this and to make a difference in people's life. Our correctional environment is making a difference. The mayor of Huntington is making a difference. We have partnerships that have developed and formed and will be long-lasting. You're making a difference. Our individuals in recovery, how proud we are of you. And there is no bad speech, and there is no challenge that you cannot achieve. You have made that evident in all the struggles and challenges that you do every single day and that you face every single day. And you're helping others to achieve the same thing. So thank you very much for that. I really am just here. I don't want to take any more of your time. I want to thank you for coming. I want to thank everyone here for your dedication and your effort, and I want you to know how very appreciative that we are for each of you. So thank all of you, and thank you, Governor Tomblin.
All right. Well, that concludes all of our speakers. I truly want to thank each and every one of you for coming out and being part of this, which is a celebration. Like Vicki said, you can literally hear folks on the other end, on the other side of the wall, taking calls right now. As we speak, there's West Virginians getting help, which is what this is all about. I invite you all to stay around. I think we've got some hot dogs and donuts. We feed people at First Choice, if you can't tell. I was like a swimsuit model when I came here. I don't know what happened. So, but please make yourself at home. Enjoy one another's company, network and talk. Thank you so much. We appreciate you. God bless. Thank you.